So if someone does the check-in today and they spot a couple of weaker areas, there are things that they can start doing straight away that genuinely will support their brain. So the first is to move a little more. With the age of office jobs and sitting all day, it's very easy to just, not move for long periods of time. Even a 10-minute walk can get the blood flowing to the brain and support heart health, which is closely linked to long-term brain health. It doesn't have to be a gym session. It can just be a little bit more movement than you did yesterday.
The flicks. Sarah Bauermeister again says, what does she say? A flush in the cheeks is a flush in the brain. So it doesn't have to be a 30-minute run. Anything that just makes you a little bit rosy in your cheeks indicates that you've got that flush of blood to your brain, which is health. Health.
I love that.
Yeah, it's good on that. I like that.
Yeah. The second one I would say is to check in on your hearing. You've already obviously done that. But if someone close to you has been turning up the TV or struggling in noisy places, booking a routine hearing check is a really simple but powerful step to treating hearing loss. Is one of the strongest ways that we know to support brain health, particularly in midlife. And the third would be to take a small step towards stopping smoking, if that's relevant to you or your loved one. Even cutting down or speaking to a pharmacist or GP about support can make a real difference. Smoking affects blood vessels throughout the body, including those that supply the brain. And we've, have spoken at length about how important keeping those blood vessels healthy is. So reducing or stopping is one of the most effective ways to protect long-term brain health, and obviously it will also decrease your risk of other health conditions as well. None of these require massive overhauls to your lifestyle, but they are small and realistic steps that people can build on, and they will all make a meaningful difference over time.
And they are such small, practical things to do, great suggestions, and there's something in there that everybody can take away, isn't there?
Yeah, definitely.
So the report shows that dementia is something that people fear, me included, which can make them avoid thinking about prevention. I'm probably not included in that bit. I do fear it, but I'm trying my best to prevent it. Mm-hmm. How do we shift that from fear to empowerment?
Yeah, I mean, it's a huge, huge question, and something that, teams of people across the world are working on to try and shift the narrative. A lot of people are frightened of dementia, and the report shows that fear can, as you mentioned, make them avoid the topic altogether. Fear shuts people down, whereas information and practical steps can open people up. So the shift we need to make is from, there's nothing I can do, it's an inevitable part of aging, or it's inherited all the time. It's neither of those things. There are steps, and there are things that we can all do to genuinely help your brain. There's no surefire way to prevent dementia, but considering at this point in time, there's no test to see who will and won't benefit from those changes in terms of their brain health. Everyone probably would in terms of their overall health. It's something that everyone could consider doing seriously. Breakthroughs in research are a big part of the shift towards people kind of changing their attitudes towards brain health and dementia risk reduction. So as we learn more about the biology of dementia, we develop those new treatments I mentioned earlier, it does become much clearer that dementia is a scientific clinical disease. It's not something mysterious or inevitable. In the past, obviously, it was unfairly categorized and people were just locked away. But nowadays we understand that it is something that we can understand and diagnose earlier and increasingly do something about, and that alone does take away some of the fear. We also need to focus on what's possible right now. So we can't change our age or our genes, but we can look after our hearing, our heart health, our activity levels, our social connections. And when people understand that these everyday things make a real difference, the conversation becomes much less about fear and much more about control. And if we keep the language positive and realistic, we're not asking people to overhaul their lives. We're asking about small, manageable steps that can fit into daily routines. So when people see that brain health is not about perfection, but about doing what you can, it becomes a lot less overwhelming and people feel more able to engage. You kind of, don't set unrealistic standards and just engage with people where they are and meet them where they are.